and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Hayward Zwerling. He's an endocrinologist and he wrote the Kevin MD article, Talking Politics in the Exam Room. Hayward, welcome to the show.
Well, thank you very much for having me here, Kevin. I think this is an important topic and I'm glad to get a chance to discuss it.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Yeah, so originally I was planning on staying in academics and was planning on doing protein structure function relationships. And after my fellowship and a year of that, it decided, okay, this is not the right path for me, and ultimately moved into private practice and has been in private practice for almost 30 years, a little more than 30 years. In the process, I created an electronic medical record program called ComChart EMR, which I sold for about 15 years. And I'm in the process of shutting down now because the market has changed. And in the last, 2 or 3 years, I've been doing a fair amount of blogging as a mode of therapy to deal with the angst that we all are having. And this article sort of arose out of a couple of clinical encounters and was a way of sort of organizing my ideas.
All right, so let's talk about that article, Talking Politics in the Exam Room. And as you know, we live in a very polarized environment currently, and politics inevitably seeps into the exam rooms, and we're both bloggers and in the healthcare blogs as well. Politics is not something you get away from. So for those who haven't read your article, can you just walk my audience through it and maybe share the story of why you decided to write it?
Yeah, definitely. The way it started was everybody is having an increasing number of encounters where patients come in with misinformation, factually incorrect information, which has an adverse impact on their health. And of course, in today's universe, facts seem to be optional. One can get to choose their set of facts. But as a physician grounded in science, there is a set of facts that I believe the data supports. And over the course of several years, or at least over the last year, occasionally either patients would bring up this information and say, what do you think about coronavirus? Or it was obvious that patients' misunderstanding of the situation was going to have an adverse impact on their health. And there have been many patients where this has evolved. Some will outright ask me, who are you going to vote for and why? There was one patient who came in wearing a Make America Great Again hat who didn't want to wear a mask in the exam room. And in our office, everybody's got to wear a mask. So the conversation was really forced. And there are others who will say to me, who will come in, the one who actually this article is mostly based on, came in and said something like, well, no, my friends all support Trump. All the news says this coronavirus stuff is fake. What do you think? And this was coming from a patient who is the focus of the article, who has type 1 diabetes, a prior history of substance abuse, and is clearly at very high risk. And he really wanted to know what the facts were. And he was a bit apologetic, presenting the coronavirus as non-factual, but his response was, but every time the news says something about coronavirus being a real problem, they're just trying to hurt Donald Trump. And so we had a conversation about it, and it led me to this article. How does one deal with this when we all have been trained to avoid these political conversations in the exam room? At the same time, what has happened in the last 5 or 10 years is we've learned that these social determinants of health and what goes on outside this exam room is as big or bigger influence on our patient's health than the patient's genetics and individual background. And I'm a firm believer that physicians, besides taking care of the patient in front of them, have a role to society to improve everybody's health. And I was trying to talk through in my own mind, what is the right way to deal with this problem? And recognizing that it is a taboo. On the other hand, it conflicts with my professional obligation to take care of the patient in front of me and the wider society to try to prevent disease. So that's really how the article came to be. And in the end of the article, I sort of argue or I try to lead the reader to the conclusion, I'm not sure what the right thing to do is. There are some patients who there's no point in having a conversation. And you have to I found I have to pick and choose when I should do it and when I shouldn't do it. It's not a matter of trying to say to people, this is what you need to believe, and this is how you need to vote. The criticisms on the Kevin MD website, the comments, were basically assuming that's what I was doing, and it's not. What I'm trying to do is, like we do with every other disease we deal with, when we talk to patients about cigarettes or seatbelts or motorcycle helmets, we try to present them with the facts as best as the science understands it, and then let them make a decision incorporating that information with their own set of values. You know, and the person who wants to ride a motorcycle without a helmet, I think it's the wrong thing to do, but that's their set of values. And I'm not going to say what they need to do, but I think they need the facts so they can make the right decision that's in their best self-interest.
Let's go back to that patient that you talked about in the case who thought that the coronavirus was an attack on President Trump. Now, where was that patient getting his or her information from?
Well, he only had one source. It was Fox News and his peers. And their one source was Fox News. And we all know over the last year, Fox has presented the charitable word would be a skewed image, but it's really much more malicious than that. They presented the facts in a way which are factually inaccurate to advance a political agenda without regard to the healthcare consequences to society. I think he probably knew that he was getting a slanted view. I'm not 100% sure, but he did acknowledge that was his only source of information. And when I come upon a patient like that, the way I try to deal with them is, rather than saying, well, my facts are right and your facts are wrong, I try to lay it out and say, look, information is very complicated. And the best way for you to get the facts is to listen to multiple news sources. And I proceed to say I read multiple newspapers and multiple websites that, span from Fox News to MSNBC and everything in between, and encourage them to do that. And then try to teach them to take all the information and come to a conclusion of what is reality, as opposed to just Fox News or just MSNBC or whatever website they were going to.
And in your experience, over especially the last few months, how has the response been of patients that you had to push back on a little bit?
Well, I try not to push back, and I don't want to make it confrontational, because if it gets confrontational, it's not going to be productive for them. I'm trying to say, this is what the science tells me, and if you do X, Y, and Z, this is going to be the consequences to your community and your health. And if you decide X, Y, and Z fits your priorities in life, that's fine. If you think that ignoring the virus is the best way to go forward, as long as you understand that's not what the science says. So I try and avoid confrontation. And there's some patients, it's obvious as soon as I bring it up, there's just no point in going forward. But I try to be respectful, and I try not to say, this is what you should do. I try to say, if you get into an accident on a motorcycle while you're on the highway, you're not wearing a helmet, your chances of being injured are far higher. If you're going to smoke cigarettes, your chances of adverse outcome are far higher. And then they have to decide what to do. So it's not a matter of telling them what to do. It's just trying to connect the dots of what will happen if they choose path A versus path B.
And if a patient asks you a blatant political question like, who are you going to vote for? How do you respond?
So that did come up, and my response to the one patient, it was and I think I put this up on the blog in response to the comments. One woman had asked me that, and I just said, I believe in science. And she stopped right there because she knew what I was saying. But she came back later in the conversation and asked me point blank who I was going to vote for and why. And ultimately we had and I responded, and I told her why, and I asked her what she was going to do and why. And she said, well, I'm going to vote for the president because he had a great economy. If it wasn't for coronavirus, it would still be a great economy, and it's not his fault. And I tried to show her how in other countries around the world, if the president had chosen to follow the lead of the scientific and public health community, there would be tens or hundreds of thousands of fewer people dead. The economy would be further along. And I tried to show her there are examples that a different choice would have had a better outcome. But I just sort of tried to lay it out. These are the facts of what happened elsewhere, not saying you're making the wrong choice. I understand it's a fraught situation, but I also think we have an obligation to our patients so that they have the information to make the best decision that's consistent with their values. And if they're only getting their information from one source, they don't have the whole story any more than anybody who gets their information only from one medical article. We all know that medicine is complicated, and it takes multiple studies to prove most points. Politics and science are exactly the same way.
Now, if a patient has a sharp political disagreement with you, how does that affect the doctor-patient relationship?
I try, if that's the case, I try to avoid politics at all costs, because it's not going to help me take care of the patient. And I then abandon this idea that I need them to understand the bigger ramifications of their political things in terms of the health of their community and family, and just focus narrowly on them. So I'll avoid that. And sometimes I'll say, we really shouldn't be talking politics, because it's not going to accomplish anything. And my first priority is to that patient. Mm-hmm. So I'll push it aside and try to move on. Usually if I do that, they don't keep pushing back and saying, I want to talk politics, although there have been some. And there have been some who've agreed, okay, we're going to disagree, but let's just move on. And sometimes it is pleasant. And if they keep coming back to me, I know I made the right decision. If they disappear, I know I made the wrong decision. But that's not usually the case.
Have patients left your practice because of a political disagreement in the exam room?
It's hard to know, honestly. I remember there was one person who the issue of guns had come up, and I tried to engage about, the importance of having locks on the guns at home and having the guns locked up and so forth. And I never saw that patient again. And I don't know if it was just because they thought I was a bad doctor, if they didn't want to hear my comments about gun safety, or that they just got what they needed and they moved on. I'm in the role of a consultant. So some of these patients, I just give an opinion and that's it. But there are others, the diabetics who I'm following for 30 years. So I assume that there are some who have left, and I just don't know the reason. And I assume there are others who come back because they want to hear more. I have to do what I think is right as a professional, which is take care of the patient and take care of my community. And there are going to be people who are going to be unhappy with that. I understand that. But my job isn't to make everybody happy. My job is to fulfill my goal in life, which is to try to help the health of my community and neighbors and the society as a whole.
We're talking to Hayward Zwerling. He is an endocrinologist, and he wrote the Kevin MD article, Talking Politics in the Exam Room. Hayward, I think that you diagnose one of the problems of hyperpolarization accurately, in that there is one side that gets one source of facts and another that gets another source of facts. Now, when educating patients about evaluating the news and information that they read, how do you approach that? And what kind of advice can you share with other clinicians in terms of how to educate patients, critically evaluate what they read, especially online?
I'm a big advocate of giving patients information and giving them reliable sources. And the source that I use most is medlineplus.gov. Now, that's the National Institute of Health, National Library of Medicine source. There's no pharmaceutical advertising. And I can say to patients, and I frequently do, I'll bring them around to the computer, I'll show them how to get online, and I'll show them how they can search any topic they want with literally thousands of links to other reliable sources. So I'll pick out professional organizations. I try to steer them away and try to explain to them, don't just type in hyperthyroidism and see what people wrote about it or the treatment, because you're going to get an anecdotal experience. And I try to explain to them how in medicine, every physician has had an experience where we prescribed a drug the first time and a bad outcome happened, and we decide we're never going to use that drug, even though we know that the data is that the drug is safe on average for the vast majority of people. And so I try to explain that anecdotes aren't a useful way to make a decision. And that's why it's important that they visit reliable websites, such as medlineplus.gov.
And in the majority of cases, are your patients pretty accepting of going to, say, a .gov website? Do you have any people who are suspicious of .gov websites because they are under the auspices of the government?
That hasn't really been an issue. Most of the patients, my experiences, will get it either from anecdotes or they like WebMD. And I'm cautious about WebMD just because of the advertising, and I don't really know what their algorithms do in the background. I also will refer them to Up to Date in Medicine, which has a nice portal for patients, which is reliable. I'm not sure if it's useful for the patients, but they seem to like the information. And sometimes they'll email me and say, where can I get more stuff on this? I try to give them honest information, which is uninfluenced by the pharmaceutical industry, all the influences which would skew what the reality they see actually is.
Well, hyperpolarization, if anything, is probably not going to get better, and in fact may get worse in the coming year or so. So I would ask you, what's your number one tip that you could share with clinicians in terms of navigating hyperpolarization that can creep up in the exam room?
My suggestion would be to first try to encourage patients to visit multiple websites. Mm-hmm. Don't go in with the sentiment and say, that website you're looking at is wrong. Go in and say, look, information is complicated. If you look at multiple sources, you're more likely to find out what the reality is. And then the second one is be respectful. It doesn't accomplish anything to get into a shouting match with anybody. So be respectful and try to teach them how they can learn what is reality beyond just their immediate bubble. And I try to follow those rules myself.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
I think the medical community really needs to have a conversation about this topic of talking politics with patients in the exam room. Recently the New England Journal came out with an editorial dying in a leadership vacuum, basically arguing that the public should vote Trump out of office because his policies caused many more deaths. And they have a very nice quote in it: truth is neither liberal nor conservative. I think we need to stay with the science and help people understand how to connect the dots from the science to the policy to what happens in their community. And let the chips fall where they may, but just be honest about it.
Hayward, thank you so much for your time and insight. And thanks again for being on the show.
Thank you for having me.